Okay. This family planning is a very important topic. The full question is many times asked, or you will get the short note or short answering question in each and every examination. So family topic, planning topic has to be on tips. This is very important topic. As far as exam is considered, as far as the clinical day-to-day practice is considered. So now coming to the what is meant by family planning. What is the definition of family planning? The definition of family planning is given by WHO in 1971. This defines that family planning is defined as a way of thinking and living. Each word is important, remember. It is defined by the WHO in 1977, which states that it is a way of thinking and living adopted voluntarily by individual or a couple to get the family size, a small family size, in the interest of the community and the country. So this is the definition of the family planning. This family planning includes, what this includes, why this is important, because the family planning services provides the information regarding the contraceptive measures, number one. It gives the information regarding the sterility, whether the couple is unable to produce the children. So it gives the information regarding the sterility. It gives the information about the how to take care of the children. That is, it says, gives the information regarding the maternal or paternal, how otherwise how to take care of the children. It gives information regarding the child feed. It gives the information regarding the immunization schedule. This gives information regarding the how to keep the family size small. It gives information regarding the vasectomy and tubectomy, how to use the contraceptive measures like copper T, condom, oral contraceptives. So these are the 11 importance of family planning, under which heading the importance about the family planning is taught to the couple, taught to the eligible couple. Eligible couple. Who is eligible couple? The eligible here couple means male and the female. Couple means husband and the wife. Legal husband and the wife. So eligible couple means what? Eligible couple is that couple who are legally married and able to give birth to the offspring. Able to give the birth to the offspring. So eligible couple is a legal couple who are allowed to give birth to the child. For that, the register is maintained at each health center. Maybe the primary health center, secondary or tertiary, or even a sub-center. The register is maintained called as eligible couple register, in which the name of the couples they are written with their age, local address, and any whether they are suffering from any disease. So why this eligible couple register is maintained? Just to find out whether that couple is able to produce the children or they are unable to produce the children. If they are unable to produce the children, the information regarding the sterility measures, what investigation can be done for those couple is taught to them. So they are properly given guidance regarding the sterility. Next is there are many contraceptive means available. Just to enumerate the contraceptive means: Nirod, male condom, female condom, oral contraceptives, then natural contraceptive measures. There are many measures, many means which can be used, but the ideal contraceptive means whatever the devices are available in the market, the ideal contraceptives, they must fulfill the 7 criteria. If a contraceptive mean or this contraceptive which has been provided to the couple, it should have these 7 ideal criteria. What are those criteria? These contraceptive mean must be simple to use. Number 1, it must be provided free of cost. Third, it should not have any chemical. Fourth, it should not cause any reaction to the couple. Fifth, once the contraceptive measure is withdrawn, stop the use of that contraceptive measure, the couple must get the children within 3 months. Means female should conceive within 3 months. So that contraceptive means should be irreversible. It should be reversible. Sorry, it should be reversible. So means what? Once you stop the use of contraceptive measure, female should conceive within 3 months. So, and it should be easily accessible. There is no need to search here and there. So these are the 7 ideal criteria for any contraceptive means. But at present, there is not a single contraceptive means or a unit is available which fulfills these criteria. That's why there is a cafeteria choice. Means what? Cafeteria means coffee house or a hotel where we go for taking the breakfast. And in the hotel we get many different types of varieties. Maybe samosa, idli, vada, dosa, whatever it may be, upma. And there is a choice for a customer to give order and eat. So there is a choice in cafeteria. Similarly, there is a choice in choosing the contraceptive measures. Contraceptive measures means what? These are the measures or means when they are used, the couple is unable to produce the child. So, ideal contraceptive criteria I enumerated, 7 criteria. But at present, not a single mean is contraceptive mean is which fulfills all these 7 criteria. That's why there is a choice which is compared with the whatever the choice we get in the cafeteria. So why cafeteria choice is called? Because as there is a choice, here is also a choice to choose the contraceptive mean. That's why it is called as cafeteria choice. Now, what is meant by contraceptive means, I think it is clear. So, for study purpose, to make the topic more simple, these contraceptive measures are classified under 2 headings. Temporary contraceptive measures. What is meant by contraceptive measures? The other name for contraceptive measure is anti-fertility device or fertility controlling device. So, for study purpose, they are classified under 2 headings. Temporary or spacing method. Temporary or spacing method. And second is permanent or terminal method. Temporary or spacing method means, temporary means when you use those contraceptive methods, the temporary you cannot, female cannot become pregnant, or male is unable to give, unable to produce their child. So those are called as temporary or a spacing method. So once you stop the use of temporary method, female can conceive. Permanent method or terminal method means once you adapt this terminal method or permanent method, couple is unable to produce the child. So today I will discuss the permanent method of contraceptive. The permanent method of contraceptive further divided under 2 headings. One for female, tubectomy, other for male, vasectomy. In exam, the student answer the opposite way. Vasectomy is carried in female, tubectomy is carried in male. ऐसा होता है क्या? So keep in mind, vasectomy is done in male. Tubectomy is done in female. This you have to mug up 10 times, then only you can understand the thing. So the why this is called as permanent or terminal means after that the couple is unable to produce the child. So two methods are further: in male vasectomy, in female tubectomy. In male vasectomy, vast difference, length is 45 centimeter. There are 4 organs in our body whose length is 45 centimeter. कोई बताएगा क्या? Number 1 is vast difference. Number 2 is length of the femur in 6 feet height person. Number 3 is spinal cord. Number 4 is esophagus. So God is very generous. उसने दे दिया है. So, but we technically, as we develop the science, we develop the skill of doing the tubectomy, doing the vasectomy in male. What we do in vasectomy procedure is, we identify the vast difference at the upper border of the testis. It is a cord-like structure. If you feel in the 2 fingers, then you give the local. Vasectomy is a very simple, less time consuming procedure. This procedure can be conducted within 5 minutes. The male can go to home after doing the vasectomy. It is a OPD procedure. But at present, only 15% of the male they are willing for vasectomy. While females, 85% of the female they undergo the tubectomy. This is a human tendency, male dominance. By even educated or illiterate people, they are not willing for the vasectomy. So 15% of the female they undergo the vasectomy. So VAS is identified, procedure of doing the vasectomy. VAS is identified, it is a cord-like structure. You can palpate the VAS difference in your 2 fingers. Give the local anesthesia 2 to 3 ml, and after identification of the VAS, dissect it, and you cut the 1 centimeter of the VAS difference, and both the ends has to be tied apart, and take 1 single or 2 skin stitches and do the dressing. This is the procedure of VAS difference. What are the complications? Complications are infection, secondary infection. Number 2 is seminal granuloma. At the cut end of the VAS difference, semen may trickle down, and sometimes seminal granuloma can occur. Third is abscess formation. So these are the very simple complications which are less likely seen. But most worst complication of this vasectomy is there is a spontaneous recanalization of the VAS difference. Means what? Both cut end, they spontaneously may come together and join, and recanalization of the VAS occurs. So even after doing the vasectomy, there is a 6% chance that recanalization of the VAS difference occurs, and that male is unable to give birth to the child. So this is the only drawback of vasectomy. That has to be explained to the male. So this is about vasectomy. Second is tubectomy. Tubectomy means there are 2 methods of doing the tubectomy. Number 1 is laparoscopic ligation of the tube, or you can open mini laparotomy. Laparoscopy means the 0.5 millimeter, not 0.5, the 5 millimeter incision is taken supra, infra, or in the umbilicus, and 5 millimeter laparoscope is passed into the abdomen, and pneumoperitoneal air is passed into the peritoneal cavity, and we do the pneumoperitoneum so that abdomen becomes distended. Look through the laparoscope, identify the uterus and the 2 tubes, and you can apply the band, silicone band. So once you apply the band to the tube, the laparoscopic tubal ligation procedure gets complete. Second procedure is mini laparotomy, means small incision is taken wherever you palpate the uterus. After opening the abdomen in layers, identify the uterus, identify the tube, catch the tube with the Babcock forceps, and 1 centimeter of the tube is cut and both the ends are tied apart. This procedure is called as modified Pomeroy's method. Now, what are the indications for tubectomy? Indication of tubectomy are the female must have the 2 living children, and eldest child age should be more than 5 years. She should be more than 45 years of age. Her age should not be less than 20 or more than 45. What are the indications for male? Male should not be less than 25 or more than 45. And there should be 2 living children, and elder son or a daughter should be more than 5 years. So this concludes the terminal